Welcome back, Diabtrons. Today, we're diving into a topic that concerns many. What is borderline diabetes? In this video, we'll explore the meaning, risk factors, and what you can do to manage it. If you find this information helpful, don't forget to hit the like button, subscribe to our channel, and ring that notification bell, so you never miss out on our health-related content. Folks, don't forget to check out our surprise for your health. Just click the link in the description box below. Ready to unravel the mystery of borderline diabetes? Let's jump right in. The term borderline diabetes is often used to describe a condition known as prediabetes. Prediabetes is a health state that occurs when blood sugar levels are higher than normal but not yet high enough to be classified as type 2 diabetes. It's a critical stage that indicates an increased risk of developing diabetes in the future. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. In prediabetes, cells become less responsive to the effects of insulin, a condition known as insulin resistance. As a result, the cells don't take up glucose from the bloodstream as efficiently, leading to elevated blood sugar levels. Beta cells in the pancreas are responsible for producing insulin. In prediabetes, there is often a reduction in the ability of beta cells to secrete sufficient insulin in response to elevated blood glucose levels. This dysfunction contributes to impaired glucose metabolism. Prediabetes is characterized by impaired glucose tolerance, meaning the body has difficulty processing glucose efficiently. This is evident in elevated blood glucose levels, particularly after meals. Individuals with prediabetes often have higher than normal fasting blood sugar levels. This indicates that the liver is releasing more glucose into the bloodstream than normal, contributing to increased blood sugar levels even in the absence of food intake. Gluconeogenesis is the process by which the liver produces glucose from non-carbohydrate sources, such as proteins and fats. In prediabetes, there is an increased production of glucose by the liver, contributing to elevated blood sugar levels. The primary marker for prediabetes is elevated blood glucose levels, typically measured by the following. Fasting blood sugar. Fasting blood sugar is a blood test that measures the concentration of glucose in the blood after an overnight fasting period. It is commonly used to assess blood sugar levels and is an important diagnostic tool for evaluating diabetes and prediabetes. Here's how the fasting blood sugar test is typically conducted. The patient is required to fast for a specific period, usually 8 to 12 hours, before the test. This means abstaining from eating or drinking anything except water during the fasting period. A healthcare professional, such as a nurse or phlebotomist, collects a blood sample from a vein, typically from the arm. The blood is drawn into a special tube that prevents clotting. The blood sample is sent to a laboratory, where it undergoes analysis to measure the concentration of glucose. The laboratory assesses the fasting blood sugar level in milligrams of glucose per deciliter of blood or millimoles of glucose per liter of blood. The results are interpreted based on established reference ranges. Normal fasting blood sugar levels are generally in the range of 70 to 100 milligrams of glucose per deciliter of blood. Results outside this range may indicate abnormalities in glucose metabolism. Elevated fasting blood sugar levels may indicate prediabetes or diabetes. The American Diabetes Association provides guidelines for interpreting fasting blood sugar levels. Normal. Fasting blood sugar below 100 milligrams of glucose per deciliter of blood prediabetes. Fasting blood sugar between 100 and 125 milligrams of glucose per deciliter of blood diabetes. Fasting blood sugar of 126 milligrams of glucose per deciliter of blood or higher on 2 separate occasions. FBS is a key diagnostic tool for diabetes and is often part of routine health checkups. It helps healthcare professionals assess an individual's baseline glucose levels, make an accurate diagnosis, and formulate appropriate treatment plans. Oral glucose tolerance test. OGTT is a diagnostic test used to assess how the body processes glucose, providing information about how well an individual's body regulates blood sugar. It is commonly used in the diagnosis of diabetes and gestational diabetes. Here's how the OGTT is typically conducted. Prior to the test, the individual is required to fast overnight for at least 8 hours. During this fasting period, they should avoid eating or drinking anything except water. A baseline fasting blood sample is collected to measure the initial blood glucose level. After the fasting blood sample is taken, the individual is given a sweetened liquid containing a specific amount of glucose. The glucose solution is typically consumed within a short period, often around 5 minutes. Blood samples are taken at regular intervals, typically every 30 minutes to 2 hours, after consuming the glucose solution. Each blood sample is analyzed to measure the concentration of glucose. The laboratory assesses how the body responds to the glucose challenge over time. Abnormalities in glucose metabolism during the OGTT may indicate conditions such as impaired glucose tolerance or diabetes. For diabetes diagnosis, the American Diabetes Association criteria includes fasting blood sugar, 126 mg per deciliter or higher, or 2-hour post-glucose, after the glucose solution, blood sugar, 200 mg per deciliter or higher. For impaired glucose tolerance, the 2-hour post-glucose level is between 140 mg per deciliter and 199 mg per deciliter. The OGTT provides valuable information about how the body handles glucose and is particularly useful for identifying conditions such as gestational diabetes in pregnant women and diabetes in non-pregnant individuals. It is typically used when fasting blood sugar results are inconclusive or when there is a suspicion of impaired glucose metabolism. The interpretation of OGTT results should be done in consultation with a healthcare professional who can provide personalized advice and treatment recommendations based on the individual's overall health and medical history. Hemoglobin A1C or HbA1c. Hemoglobin A1c is a blood test that measures the average level of glucose in the blood over the past 2 to 3 months. This test is commonly used to assess long-term blood sugar control in individuals with diabetes. Here's how the hemoglobin A1c test works and its clinical significance. Glucose in the bloodstream can attach to hemoglobin, a protein in red blood cells. This attachment process is called glycation. The higher the glucose levels in the blood, the more glucose binds to hemoglobin. Since red blood cells have a lifespan of approximately 120 days, the HbA1c test provides a stable indicator of average blood sugar levels over the past 2 to 3 months. The test involves a simple blood draw, similar to other blood tests. Fasting is not required for the HbA1c test, making it a convenient option for assessing long-term glucose control. The blood sample is sent to a laboratory, where the percentage of hemoglobin that is glycated or attached to glucose is measured. The result is reported as a percentage of total hemoglobin. The HbA1c result reflects the average blood sugar levels over the previous 2 to 3 months. The HbA1c test is a valuable tool for healthcare professionals in managing diabetes. It provides an overall picture of blood sugar control and helps guide treatment decisions, medication adjustments, and lifestyle modifications. For individuals with diabetes, regular HbA1c testing is recommended to monitor long-term blood sugar control. Elevated HbA1c levels are associated with an increased risk of diabetes-related complications, including cardiovascular disease, kidney disease, and nerve damage. It offers a more comprehensive view of blood sugar control over time compared to tests that measure glucose levels at a single point in time. The management of prediabetes involves lifestyle modifications aimed at improving blood sugar control and reducing the risk of developing type 2 diabetes. Here are key components of the management plan for prediabetes. Adopting a balanced and nutritious diet is crucial. Focus on whole foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. Choose high-fiber foods to help control blood sugar levels. Reduce intake of processed and sugary foods. Losing excess weight, if overweight, is a primary goal. Even a modest weight loss of 5 to 10% of body weight can significantly improve insulin sensitivity and reduce the risk of progression to diabetes. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity aerobic exercise per week. This can include activities like brisk walking, cycling, swimming, or any exercise that raises the heart rate. Incorporate strength training exercises at least twice a week. This helps improve muscle mass and further enhances insulin sensitivity. Be mindful of portion sizes to avoid overeating. Use smaller plates and pay attention to hunger and fullness cues. Reduce or eliminate the consumption of sugary beverages, including sodas and sweetened juices. Opt for water, herbal tea, or other low-calorie, non-sweetened beverages. Regularly monitor blood sugar levels as recommended by healthcare professionals. Practice stress reduction techniques such as meditation, deep breathing exercises, yoga, or other activities that promote relaxation. Chronic stress can contribute to elevated blood sugar levels. Prioritize getting sufficient, quality sleep. Lack of sleep can negatively impact insulin sensitivity and contribute to weight gain. Schedule regular checkups with healthcare professionals to monitor overall health, assess risk factors, and make adjustments to the management plan if needed. In some cases, healthcare professionals may prescribe medications such as metformin to help manage blood sugar levels, especially if lifestyle modifications alone are insufficient. It's important for individuals with prediabetes to work closely with healthcare professionals, including dietitians and exercise specialists, to create a personalized and sustainable management plan. Lifestyle changes are often the first line of defense against the progression of prediabetes, and consistent adherence to these changes can significantly reduce the risk of developing type 2 diabetes. And that concludes our exploration of what is borderline diabetes. We hope you found this information insightful and empowering. If you have any questions or topics you'd like us to cover in future videos, drop them in the comments below. If you found value in today's video, don't forget to give it a thumbs up, subscribe to our channel, and hit the notification bell to stay updated on our latest health content. Your support means the world to us. Connect with us on social media for more health tips, community support, and exclusive content. We'd love to hear from you. Thank you for joining us on this health journey. Remember, knowledge is the first step toward a healthier you. Take charge of your well-being, and we'll see you in the next video.